Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. We do this to support and engage chosen family, friends, neighbors, really anyone who's caring for someone else. My name is Katie Muirhead and I'm going to be your moderator for today. We begin this gathering by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet in a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the land which we each call home. The land that I'm standing on today is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendships of Indigenous peoples. As team members at the Ontario Caregiver Organization, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. We invite you to take a moment to reflect on the land where you are. And if you're not familiar with that, we'll be sharing an interactive map that tells you which traditional territory your city or town sits on. You can find that at native-land.ca. So our webinar today is called Boost Your Wellbeing with a Nature Prescription. We're joined today by Dr. Melissa Lam. Dr. Lam is a Vancouver-based physician and director of Park Prescription for BC PaRx Foundation, and she's joining us to speak about the benefits of spending time outdoors. Today, we're going to learn more about the mental and physical benefits of nature, tips on how to fit outdoor time into your busy routine, and more about the Park Prescription program that's now available in Ontario. Dr. Lam is a widely published writer and a resident medical expert on CBC's TV lifestyle show Deepen and Chris for 4 seasons, and currently appears on air as a regular contributor to CBC Radio and CTV News. So I want to welcome Dr. Lam.
Hi, everyone. It's a pleasure to be here. Thanks for that nice introduction, Katie. So as you mentioned, I'm Dr. Melissa Lam, and I'm joining you from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations on the west coast of this beautiful country in Vancouver. And I'm just so pleased to be here today speaking to some of the people across this country who are really important for not only making sure that our families, our friends, our loved ones are cared for, but also just form such an important potential part of the movement to get people outside because of the connections that we and you have. So the first thing I'm going to do is just ask people in one word to describe how you feel when you're outside in nature. So obviously we can't hear you, but if you just type that into the chat, I want to just think about when you're in a park or when you're in a green space or by a blue space, how you feel. And I'll just give you a minute to do that. Seeing lots of calm, awake, peaceful, refreshed, and rejuvenated. And so we've done this exercise with a few other groups when we give these presentations, and a lot of the words that you brought up are similar to the words that we see. So you can see other groups have said calm and peaceful are two of the major ones, happy, wonderful, grounded. And what's really great about spending time outside is that we have this intuitive sense that it makes us feel better, but it's really backed up by evidence. And so I just want to talk a bit about my own journey into nature prescribing and how I discovered this amazing evidence and the intuitive sense behind why nature is so good for us. So my first job as a rural family physician was in northern BC. I was as a full service rural family doctor straight out of residency, and I was suddenly thrown into being very responsible, running an emergency department, delivering babies in the middle of the night, taking care of acute inpatients in a setting where there were only family doctors and not any specialists. So not lots of backup, but a lot of collegial support. And even though it was very stressful in terms of my practice, I loved it. And I think part of the reason why was because after I would go to work, I would be able to head out into the mountains, on a stressful shift. I would walk. My commute to and from work was through and past the community garden and I could pick wild raspberries on the way home. I lived about a 6-minute walk away from the hospital on the hospital grounds in the middle of the woods and could see mountains out my front window. And I didn't realize it at the time, but I think it was really an important part of why I was able to remain resilient and why I loved that community so much. Fast forward to a couple of years later, moved back to Toronto where I was born and basically close to downtown Toronto at Yonge and St. Clair. And suddenly the only nature I could see, I don't even know if you could call it nature, but it was a little square of sky with the CN Tower in it between two skyscrapers. So like concrete and glass. And I found myself so much more stressed when I was living there, even though the work was a lot easier. I was doing outpatient medicine in student health at the University of Toronto. I just felt stressed all the time. So I remember the exact moment when it dawned on me. I was standing in front of the window, listening to the streetcars rumble, looking at the crowds, hearing the cars honk, looking at that little square of sky and thinking, why am I so stressed? And then realizing, I think it's because I'm missing nature. And so like any, good evidence-based health professional does, I went to my computer, I sat down and I started doing a literature review online about, what the possible evidence could be behind the health benefits of nature. And I was actually shocked at this deep, decades long body about the evidence of research about the evidence behind the health benefits of nature. And I thought, I didn't learn this in medical school. I had no idea, even though I've loved being outside my whole life. I want to make it my mission to spread the knowledge about the health benefits of nature to my colleagues and the general community. So I started writing about it, talking about it, connecting with people. One thing led to another. As Marnie mentioned, I eventually became the medical expert on Stephen and Chris. And so I wanted to play for you a video from this time about a decade ago when I first started talking and teaching about the health benefits of nature.
Hey guys, I've brought you here to my local park today to show you 3 easy ways you can connect to nature and the amazing health benefits you can get by getting outside. A lot of us sort of feel good when we go outside into nature, but now there's actually scientific evidence showing that our health benefits hugely when we head out into nature. Let's go. We all know exercise is great for the body, but if it's a nice day in your neighborhood, why don't you head outside and do it outdoors? Getting active in nature improves your blood pressure even more than if you exercise on a city street. One study showed that people who exercised looking at nature had better moods and better self-esteem. So to get the most bang for your buck when you're exercising, get outside to improve both your physical health and your mental health too. There was one major study looking at the amount of green space near where kids lived, and kids who had more green space closer to their homes tended to be at a healthier body weight, and the theory was that that was because they're more active and playing more in this green space. So minimizing your screen time and increasing your green time is a great way to make sure that kids get more active. So many of us eat our lunch inside, staring at a computer at work. But if your boss is okay with it, why don't you take your lunch outside and eat it at a nearby park? Nature is actually a proven brain power booster that will help you focus through that long afternoon at work. Walking for less than an hour inside a park improves your memory and concentration. And actually, just 15 minutes sitting in nature lowers your stress hormone or cortisol levels as well as your heart rate. Studies show that just 20 minutes of walking in the park can improve ADHD symptoms just as much as prescription medication. So who doesn't love catching up with a friend over coffee? Next time you grab that coffee, get it to go and hit up your local park for a stroll. Short trips to the forest actually increase your levels of natural killer cells, which are your first line of defense against pesky viruses. In fact, just breathing in the scent of trees has been shown to increase your immune function. I hope you learned some really interesting information that will motivate you to get outside and into your local green space. Imagine how healthy you could be if you added a little green time into your day every day.
All right. And so as you can see, and as I mentioned in that video, there is a huge body of evidence behind the health benefits of nature. So from improving your bone density to reducing your risk of diabetes, heart disease and high blood pressure, to reducing depression and anxiety, improving ADHD symptoms in kids, as I mentioned, lower pain responses after surgery in hospital, better work satisfaction. There's this massive body of evidence behind the health benefits of nature, which is why I and many of my, the over 6,000 prescribers across the country that we have are so passionate about spreading the word about the benefits of nature and prescribing it to their patients. And so as a physician, people often ask, why aren't you sticking to your office? Why are you starting to talk about issues outside your office? Like, shouldn't you just be doing, putting your head down and working in your office? And so the reason is because only 20 to 25% of our healthcare status comes from what we do in the healthcare system. And 75% or 80% comes from everything outside of our healthcare systems that we traditionally, as physicians and healthcare professionals, don't have control over. So as you can see, if you look at that column in the middle about all the different factors that make Canadians sick or well, a lot of them can be influenced by having better green spaces around us, which foster more social inclusion, make us feel more less lonely, more like we have a sense of belonging, increase safe and nutritious food in our communities. So that's why, as a physician who really cares about my community, I want to take my practice outside of my office and connect people to nature, which is so powerful for improving people's health. And so I want to talk a little bit about the theories behind why nature is so good for our brains, because again, as someone who's trained in science, I think, like, what is the mechanism behind this? Sure, it's great to go outside, but what's going on in my brain? So the first theory is called attention restoration theory. And it says that when we live in busy urban environments, they require a lot of our focus. They require a lot of directed attention to navigate around the lights, the busyness, the people, the hard edges, and the traffic. And what that does is it tires out our powers of conscious attention and increases our fatigue and irritability. Whereas when you spend time in nature, it's actually a source of soft fascination. So it's interesting, but it doesn't require us to constantly direct our attention and tire our brains out. So that restores our attention and it reduces that fatigue and irritability. And then also, the second theory is called stress reduction theory. So this theory says that when we spend time or when we experience stress, spending time in nature actually reduces our recovery from that stress. So it increases our resilience. And that kind of comes down to evolutionary thinking. So if you think about it, when early humans spent time in different kinds of environments, when they spent time in biodiverse environments, they tended to have more water, more sources of food, trees that you could use for shelter or climb up to look for predators or go get away from predators. And so our early brains of these early humans evolved to want to basically feel more safe and spend more time in nature because it was a survival benefit to be drawn to these biodiverse spaces. And essentially we've passed on those nature loving genes to future generations. So it's not only looking at nature and being in nature and seeing it, which is good for our bodies and brains. There are also compounds in the air, which I mentioned in that video, called phytoncides, which are these volatile organic compounds that plants and trees release that are traditionally used to kind of fight off insects and fungi and different pests. But when humans breathe them in, they actually boost our immune system. So there's studies showing that when people are exposed to phytoncides, even if they're just inside a hotel room for a few nights, that bumps up their numbers of immunoproteins and the activity of their natural killer cells, which are prime immune cells that fight off viruses and bacteria. So from looking at nature to hearing the sounds of nature to smelling it, there's so many different ways that it's good for our bodies and our brains. And so I want to get a bit, not too much though, into some of the studies behind why nature is so good for us and that show why nature is good for us. So this was a study that was done right in Toronto, and it combined high resolution satellite imagery, individual tree data, and Ontario Health Study data and self-reports of health perception. And what they found was that after they controlled for a number of different factors, so income or proximity to like major roads and that sort of thing, they found that 10 more trees per block improved people's health perception, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So in the healthcare system, we know that two major factors that determine people's health status are both income and age. And so I thought this was a really neat study, not only because it was done locally in Canada, but also because it brings down tree exposure, something very measurable, down to a level of something that we can compare it against that we know improves health. So this is a really neat study. The second study I alluded to actually in that video, and I like this one because it speaks to nature as medication. So this study was done in Chicago. They looked at 17 kids with ADHD, and they guided them on 3 20-minute walks through a city park, through a downtown area, and through a residential area. And they found that the 20-minute walk in the park improved their digit span backwards performance. So this is just a simple test where you recite a series of numbers in a row and then ask the participant to recite them backwards too. The more you can recite, the better your memory and attention. So this improved their performance to levels in children without ADHD. So you can see in this chart here, this bar here is the walk through the park. And so again, it kind of separates out the influence of exercise or just being outside in fresh air from green space. Because as you can see, the park walk actually increased their DSB score significantly more than just the neighborhood or downtown walk. And when they crunched the numbers, this actually, the effect rivaled the peak effects of Ritalin. So no one is saying, obviously, that a walk in a park for 20 minutes is going to replace everything that prescription ADHD medication does. But I think it speaks to how powerful nature exposure can be as an adjunct to what we traditionally prescribe and do in the medical system. So it's time for a bit of interaction. This is our second poll, I guess, of the webinar. And again, as a physician, I think, so, okay, I'm prescribing something, that's great. There's evidence that it's good, but how much am I supposed to prescribe? And so I want you to answer in the chat, or actually in the poll that I'm hoping that someone's gonna launch soon. People report significantly better health and well-being after spending how much time in nature per week? So is it 1 hour? Is it 2 hours? Is it 3 hours, 4 hours, or 5 hours? What do people think? I'm seeing 2 hours, 3 hours, 4, some ones, 5. Okay, so I feel like the majority of people said 2 or 3 hours, and a lot of you are right. So this was a study that came out in 2019, just as we were developing our program, and we were very lucky it was that happened at that time because it speaks to dose. So this was a study of almost 20,000 adults in England, and what they found was their likelihood of reporting good health or high well-being was significantly greater when their nature contact reached greater than or equal to 120 minutes per week recreationally. And again, they controlled for income and green space nearby and kind of health status. And so these positive associations continued to increase until they hit about 200 to 300 minutes per week, or that sort of 5-hour mark. And anything after that didn't seem to improve their health at all. So, you know, we're not saying once you hit your 2-hour mark, stop spending time in nature, but really if you want to maximize your health and well-being, that 2-hour mark is a sweet spot for how much time you want to spend in nature each week. So remember that. And we have another poll here. So the how much time should we spend in nature each time? Is it 5 minutes? Is it 1 hour? Like, how do we get the biggest bang for our buck, you know, in terms of our stress levels and our health? So again, I want people to answer in the chat what they think the most efficient drop in cortisol level happens between how many minutes or hours in nature. Okay, we're across the board here. It looks like pretty even distribution of the answers. But some people are zeroing in on the numbers 2 and 3, the 20 to 30 minutes. Okay, and the answer is actually 20 to 30 minutes. And this was a study that came out also in 2019 as we were designing our program, looking at cortisol levels, which are a reflection of stress because it's our primary stress hormone, and how much time people spent in nature. So over 2 months, they asked 36 urban dwellers to have a nature experience in an outdoor place that brought them a sense of contact with nature. And the really interesting thing was they have them self-define this. So they didn't say you have to be in a park with X number of trees and like this much traffic noise or lack of traffic noise. They said, you spend this time somewhere where you feel like you've had a meaningful nature experience, and do this at least 3 times per week and for 10 minutes or more. And what they found is that their cortisol, or again, stress hormone levels, dropped over 20% more after a nature experience. And the efficiency of that drop, or how quickly the cortisol dropped, was greatest between 20 to 30 minutes, which you can see in this third kind of discontinuous line here. So we're very busy, you know, we have a lot of obligations and a lot of things on our plate. And so if you can remember to get the biggest bang for your buck in terms of stress hormone and stress reduction, it's between that 20 to 30 minute mark. And again, more can be better, but for greatest efficiency in modern life, between 20 and 30 minutes is great. And I'd like to emphasize again that it's in a place that feels like you've had a meaningful nature experience. So a lot of people find that in the city, it's harder to find green space, but if you are lucky enough to have a backyard in your garden, in a park on the corner, you know, of 2 streets, if you can slow down notice the green around you and connect, then you can experience those health benefits. And so thinking that this is a talk I'm giving to caregivers, I want to talk to you about how to maximize your own nature prescription or your own green time, and how to make sure that you're incorporating it in a meaningful way into your lives. So as mentioned, you want to aim to spend at least 2 hours a week in nature and at least 20 minutes each time. And a lot of people say, how, I'm so busy, how am I supposed to fit this into my routine? And there are ways that you can tweak your routine to make it to fit green time in. So for example, if you happen to be meeting a friend or family on the weekend, instead of sitting in a cafe, which might not be the best reason because of COVID anyway, or indoors, meet them outside, especially as the weather gets better. Schedule, take your lunch if you're working outside and sit on a bench instead of sitting inside in your computer. If you have a commute to work and you happen to have a green corridor or green streets that you can walk along, instead of taking your car, ride your bike or walk and really slow down and notice that nature around you. There are lots of easy ways that you can make those green tweaks. And also write nature into your schedule. There is evidence showing that when you write things down, we're more likely to do them. And if you actually schedule green time for yourself, if you're the kind of person who likes to make sure that everything is organized in your life, write it into your agenda, and or type it into your agenda, and there's a higher chance that you'll do it. Also, support from friends or family members can really increase the chances that we'll make a change. So commit to meeting a friend or family member outside at a certain time, maybe even every week on a Monday at 7 p.m. or something for that walk in the park, and making that part of your routine and connecting to people. So you build those social connections, and that happy feeling of well-being in those green spaces can again motivate you to spend more time outside. And last but not least, respect nature and yourself. So when you head outside into nature, you want to make sure it's a good experience, especially if you're bringing loved ones, children, people who might not be the most mobile or even know how to spend a lot of time in nature. So make sure you have warm clothing. Make sure that if you're going somewhere further afield, you let people know where you're going, and treat nature with respect. Don't litter. Make sure that you take only pictures and leave only memories when you're spending time outside. And so a lot of people ask, why is the BC Parks Foundation, who is focused on conservation and expanding green spaces, why are they focusing on health? Like, why are they launching a nature prescription initiative? And the reason is because health is a really effective message to motivate people to make changes, and also engage in donations, even in pro-environmental behaviors and action for conservation. So we take lessons about health and its messaging from the body of research on climate change. There were surveys done with over 7,500 participants in 5 countries around the world, and they asked participants to read 5 pairs of statements and ask them which would make them more likely to support policies tackling climate change. And they found when they proposed these policies in different frames, so health frames or environmental framing or economic framing, they found actually that framing policy suggestions in terms of their benefits for health increased support. And this was even among people who weren't really concerned about climate change. They found that economic framing had no effect. So we often hear from our governments, the reason why we should do this is because it's so good for our economy. The average person actually didn't care that much about that messaging. They also found that opportunity framing increased support. So saying these are all the positive things that will happen when we do this thing, as opposed to these are all the negative things that will happen if we don't put this policy into action. And they also found that focusing on present impacts were more motivating than focusing on future impacts. And that's what we really try to do in our program. We focus on health. We focus on the benefits of nature. We focus on the immediate impacts and the benefits to people when they spend time outside and when there's more nature in our environments. And this is much more motivating to change people's behavior. So a little bit about why connecting to nature is good for the planet. So I work in the healthcare system. I'm proud to be a family doctor, but our healthcare system is actually a major contributor to global carbon dioxide emissions. If global healthcare were a country, it would actually be the 5th highest emitter in the world. So anything that improves people's health, reduces the burden on the healthcare system, is going to reduce overall carbon emissions. Also, having more nature in our cities makes our cities healthier. So not only does it make us directly healthier because we have more green space and those health benefits around us, but also I'll mention a bit more in the next slide, having more trees and green space makes the actual infrastructure healthier for humans. Children who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. So there is research showing that people who are more connected to nature are not only more likely to engage in more conservation behaviors, because it totally makes sense that we protect what we love, but they also happen to do more other pro-environmental behaviors. So this includes recycling more, saving more electricity, voting with climate action in mind. So I like to think that every time I or one of my colleagues writes a nature prescription and connects another patient to nature, that we're doing something for the planet at the same time. Also, Inger Anderson, the executive director of the UN Environment Program, has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So if we fully embrace nature-based solutions for climate change, so what these do are they expand and protect and restore green and blue spaces while tackling human issues at the same time, and while reducing greenhouse gas emissions and kind of sucking carbon into these spaces. If we fully embrace those, this could get us over a third of the way towards our Paris Agreement targets by 2030. And so investments in nature-based solutions for climate change are nowhere near where they need to be. I think the latest estimate is maybe around 5% of investments in overall climate solutions are in nature-based solutions. And so with the leverage of our trusted health voice and with this message that nature is good for our health, I think if we get that out there in a major way, that can help close the gap in investment and make sure that we keep this planet and our spaces healthy for our generation now and for generations to come. And if you think about the impacts of climate change on our health, here on the West Coast, we had the heat dome that killed hundreds of people, followed by flooding, and then of course the wildfires that we're seeing season after season now. And this really has an impact on not only our physical health, but our mental health. And connecting to nature is a really powerful way to improve our resilience in terms of mental health and make sure that we're prepared for what's coming, and also to be able to appreciate what we have now. Okay, so a bit more about how nature makes cities healthier. So there's so many reasons why trees and green spaces are so great for our built infrastructure. So having trees reduces the need for air conditioning because of shade. They lower energy demand because of reduced air pollution and greenhouse gas emissions. Trees also remove pollutants from the air. They suck carbon into their trunks and leaves. Having more green space reduces stormwater runoff and improves water quality. And it's estimated that every $1 invested in a tree returns up to $3 in benefits. This is a map of what happened, like the heat map during the heat dome that we had in BC. And 70% of hospitalizations in Vancouver Coastal Health Authority came from this area in the downtown east side, which also happens to have some of the least trees in our entire region. And so really having access to green space is an equity issue. Not only is it good for our health in many ways, but it also, again, reduces heat and makes our infrastructure more habitable to humans and more resilient. So that's why in my role as president-elect of the Canadian Association of Physicians for the Environment, in a major way, we're trying to advocate for more green space and more trees in our cities to make all of us healthier. So we've been really, really fortunate to be recognized by organizations around the world about basically in terms of what we're doing to motivate people to connect to nature and inspire them to protect and restore nature as the foundation of our health. And the next video I want to share is one that was created by the World Economic Forum, inspired by our program. And actually, this is the forum where all these basically billionaires and politicians and celebrities actually gather once a year in Davos to talk about solutions to the issues that ail the world. And they actually created a video kind of inspired by our program. So I want to share that. Anyway, we've been so gratified for the amazing amount of attention that our initiative has gotten globally and across Canada. All right. And so I just want to talk a bit about our nature prescription initiative quickly. So if you're interested in more about nature prescribing, you can head to our website, parkprescriptions.ca, and there are lots of practical resources for both physicians and patients about the health benefits of nature and how to connect to it. So if you're a healthcare professional, if you're a regulated healthcare professional in Ontario, or in any of our provinces where we've launched, you can register for our program and you'll be sent a customized nature prescription file that you can use to prescribe nature and log nature prescriptions on our website. And if you're a patient, we have all kinds of different fact sheets, all kinds of information about the way nature is, or about how nature is good for a number of different systems in our bodies, from our lungs to our hearts to healthier weight. And these are broken down into adults and children. So take a look on our website about these at these resources. This is just an example of more publicity that we got about our offer, where now regulated health professionals in our program. So it doesn't have to be a physician. It can also be nurses, physiotherapists, psychologists, anyone registered in our program to prescribe can actually prescribe one free PaRx Canada Discovery Pass per month to a patient who preferably lives close to one of the PaRx Canada administered sites, but also for whom cost could be a barrier to nature access, because we're not only recommending or prescribing nature, but we also want to reduce barriers to nature access. So this is one of the ways that we're doing it, and we're actually talking with transit organizations and other nature-based venues to be able to connect people to nature more easily. And so in terms of what we can do individually, what I want you to remember is each of you, please spend at least 2 hours in nature each week and at least 20 minutes each time. And I want you to spread the word to your doctor and other healthcare professionals about PaRx prescriptions if they don't happen to be enrolled in our program, so they can start building the movement. And if you know a nature-based organization or venue, please connect us, because again, we are building out our group of partners who are offering more nature experiences to patients to reduce those barriers. And also, if you're interested, donate to the BC PaRx Foundation to support our work. And I just want to share one more video, which just came out actually on CNN last week about, and I think it's especially relevant to caregivers, because there's actually a caregiver. There's a caregiver in this video that I think she's one of the first people who was prescribed nature through our program. And I think it's really heartwarming. So I want to share this final one.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75, so I'm going to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. PaRx Prescription, or PaRx, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with PaRx Canada, where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these PaRx Canada discovery passes, that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, "You're absolutely right. When I spend more time in nature, I feel better." And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
All right, thank you, everyone. That's it for the presentation. I'm happy to take questions.
Thank you so much, Dr. Lam, for joining us today. That was a wonderful reminder on how important nature is to our health and well-being, and certainly has encouraged me to get outside today. We do have time for questions. So if folks do have some questions for Dr. Lam, feel free to put those into the chat box. We've got about 5-10 minutes before we wrap up for the day. We've had some great comments and feedback. And one of the thoughts and questions that came in was, I guess, around a technique or a concept called grounding. One of our participants here is asking, are you familiar with grounding, like bare feet on the ground? And do you have any thoughts or comments on that kind of approach to getting involved in nature?
Mm-hmm. I've heard about that, that practice. And while I don't know that it's the most evidence-based, I think it has to speak with you kind of connecting to the earth and changing your electrons and that kind of thing. I mean, if it means that you're getting outside in nature and connecting, because you're literally connecting in that way when your shoes are off and your socks are off, standing in the dirt, being exposed to the microbes, which are actually good for our skin and our overall flora, that's good for you. So, you know, as long as it's not -20 out there and you're getting frostbite, you know, from grounding, I'd encourage it. And so again, while I don't think there's a lot of evidence behind the actual theories behind grounding, anything that gets you outside and makes you feel connected to your environment is a great thing.
Yeah, I would agree. I think it's whatever works for you, right? I mean, everyone's got their own interests, and some people might want to ride bikes or go for walks, and some people may want to stroll along the beach and get their feet wet, and everything in between. So that's wonderful. Lots of feedback too from the group around some of the professionals joining us today interested in reaching out offline and chatting a little bit more about incorporating the practice into their businesses and their nonprofits. I'm just looking through the comments here. We have a comment from one of our attendees saying, "Thank you. Sometimes my biggest challenge is finding workers who will be active in getting outside in nature. They're key to working with my adult child who has an intellectual disability." And so that's certainly a challenge too, sometimes when we have outside staff that want to encourage our loved ones. Do you have any tips or resources that maybe families could share with their support staff or their support teams that they could pass along as encouragement to get folks outside?
Yeah. Do you know what's really interesting? And I think I don't know if I actually mentioned it specifically in the talk, but you don't have to be active in nature to reap the health benefits. Like even if the caregiver could just take your child, you know, to a park and sit on a park bench, like that's all that's needed. They don't have to walk even, you know, they have to get to the park, I guess. So naturally you'd be taking a few steps from the vehicle or whatever to, you know, to the park bench. But that's the nice thing about nature prescriptions is they're so accessible. Like if you ever go outside, you can fill your nature prescription in any kind of green space around you. So don't let physical activity be a barrier. Another principle I think that's important is to bring nature inside if we can't go outside. So there is research showing that if you look at even photos of nature on your walls, if you play bird song or the sound of water, that can improve mental health outcomes and your mood in real time in your own home. So if you have houseplants, if you put up photos of nature, play those nature sounds, that's a way, even if you can't go outside, to experience some of the benefits of nature.
Yeah, those are some really great tips and suggestions. I think sometimes our caregivers are doing shift work. They're maybe supporting their loved ones in the evening and they're working full time during the day. So finding those 2 hours a week or 20 minutes per time can be tricky. So I think that's so helpful to know that, we can get creative and bring outside inside and sort of spark some of that calming, those calming benefits from nature without having to leave the house necessarily. I'm just looking here through this question might also help some other caregivers. My teenage son has autism and COVID has exacerbated fear of being out of house. So certainly we've heard lots of anecdotal information about folks having some hesitancy to leave with the pandemic. Any tips on how to get people with anxiety around contamination and the pandemic to get back to playing outdoors?
Yeah, that's a great question. And I definitely have people in my life, other parents with kids who they've really kept their kids away, from other people in general because of fear of catching COVID. And so I think it's little by little, right? Maybe if you took, your son out to a park where they're not touching anything, where they're just kind of walking along a trail, looking at things and maybe suggesting the odd time, oh, look at this leaf, or, look at this berry. I'm not sure what nature is in your neighborhood, but just little by little, wearing the mask if that's what they feel comfortable doing, and just gradually reintroducing them, I think. But yeah, getting them used to the outdoors again without having to touch the outdoors necessarily. I feel kind of the same way, even though my son runs amok on playgrounds now. At first I didn't want him to touch the equipment because of COVID, but yeah, just little bits and then expanding them as they feel comfortable.
Yeah, that slow transition and maybe taking that concept that you just shared about bringing outside in and starting there and piquing that interest and then making those, little incremental changes to getting out. That might be a good suggestion to be said for folks that struggle to get out in general. Anyway, if they're a little resistant to the outdoors, maybe they're a little too comfortable on their couches with their technology and their devices, taking even those 5 minutes might help get you to the 20 minutes. We've got some comments here around some strategies and places for folks that are in the Kawartha area if they want to access local conservations and forest walks. And there are certainly, for folks joining us, lots of different groups around the province of Ontario, whether it's conservations or local community groups that run these kinds of hikes and walks. So great opportunity to get connected to your community as well as get outside. Are there any other questions from the audience? We've got a few more minutes here. I'm going to give folks another couple minutes to put any of their final questions or comments or thoughts into the chat. I'm wondering, Dr. Lam, you shared the link to the Nature Prescription site, which I think is going to be a really great resource and tool for folks. And as a reminder, we'll send those resources out to people after the webinar along with the recording. But for those that maybe want to have a conversation with their family physicians, nurse practitioners, the medical professionals in their life, do you have any sort of starter tips on how to get that conversation going or maybe get this information into the hands of their family doctors that might be able to prescribe this to a lot of people?
Right. So this is something that I've heard from my colleagues is that those who aren't already on the nature and health train, they say, oh my goodness, one more thing, that I have to do in my practice is going to take more time. But what I do, and what you could do actually, if you're a patient and in your doctor's or nurse practitioners or whoever's office, is when they do counseling around, say, diet or exercise or sleep, you could bring up the idea of nature time. Say, hey, I heard about this nature prescription program where they're saying nature time should be the 4th pillar of health. What do you think about that? Maybe you should check out this website, and don't, put pressure on them or whatever in that visit to start prescribing or registering, but mention it to them in kind of a friendly way. Some healthcare professionals, they like, this doesn't apply to me. I love it when patients do research and bring me interesting and new information, because how can I know everything? They kind of don't like not knowing about things. So just kind of mention it in a casual way and say, hey, have you heard about this program? And see where it goes from there.
Yeah, great suggestions. And we just have a question about clarifying who's eligible. You'd mentioned in that nature prescription that a lot of the time they can give you that prescription for a park pass. Can you just clarify who's eligible to get those free passes?
Right. So it's anyone who has a condition that nature would make better. And so that really applies to almost anyone. One thing to remember is that children get free entry into all PaRx Canada administered sites. So if you're 17 or under, if you're an adult, you can take your kids, but it's really directed from the healthcare professionals side. So thinking about who lives close to a PaRx Canada administered site, who really needs it, like for whom is cost a barrier to access, and then they'll kind of determine who should qualify for the pass, and they can prescribe one pass per month.
That's great. That's great. Any other questions? Somebody's made a suggestion, have an annual prescription park pass awareness day. So maybe that's an approach we can take, as I'm sure that there's some sort of outdoor nature, mental health, well-being. It is Mental Health Awareness Week, I believe. I might be messing up that title, but it aligns perfectly with mental health and well-being and getting outside. So maybe
just so you know, we've thought about that actually. There is kind of an international park prescription day, and Canada hasn't quite gotten its act together in terms of joining, but maybe next year we're talking about, I think it's happening right around now actually, is kind of park prescription day. In the US, I think everyone gets free admission to state federal parks.
Nice.
Something we could definitely hopefully spread here to Canada.
Definitely, yeah. Is there like a social media site or a hashtag or something that if folks that do follow that, they want to follow it online and they can help spread the word that way? Is that something like that exists?
I don't know, actually. I don't know the answer to that.
We'll look into it and we'll see, because word of mouth is the best way to spread the word, right? So that's great. Awesome. Okay, well, I think that might be all of our questions for today, unless folks have any last minute burning questions they want to ask Dr. Lam while we have her. This was wonderful. Yes, Leslie, you're right. It was a wonderful presentation. We want to thank you again so much for joining us, Dr. Lam. We appreciate the great tips and strategies that you shared and introducing us to the PaRx prescription program that's now available in Ontario.